following is a Scotch Media production.
They can use their insurance to make money off these clients, and that's what it's all about. Instead of actually treating the client. So.
Welcome back to another episode of the Easewell Podcast. I'm Dr. Cara, and sitting down with a really good friend of mine and an amazing practitioner, Mr. LaQuawn James. Here he is. He's a nurse practitioner, and he has a whole lot of letters behind his name. So let's get to knowing him a little bit better.
I work very hard for them, first of all.
Of course.
I was a registered nurse before. I worked in the ER and ICU. Then I went to school to get my APRN, which is my advanced practice registered nurse, which is also I specialize in 13 and above. And then I also have certifications as a health coach as well. So I do a lot of nutrition coaching and things like that. So I know a lot about weight loss and body types and how to get people to their goals, no matter if they're coming from skinny to muscle or fat to smaller. So, I pride myself on knowing those things. A lot of practitioners don't know that type of stuff. So I'm able to get people to their goals no matter what that is.
Yeah, I've seen the products or actually the end product many times. I have friends that see Mr. James often, and he's done amazing things with their lives and their well-being. So I'm super, super happy to have him here on the podcast with us so we can, talk about things that you may have not thought about. And if this is interesting to you, please reach out to his office and get the best care you possibly can from this guy. So let's dive in. First, when a patient comes in, what do? You get their blood work?
Well, the first thing is they get a hug.
Of course. There you go.
Because I'm not a little person. So I just want to make sure the energy in the place is great, because I am a gentle giant, but, the size can be a little bit intimidating. But first of all, I like to see what their goals are and things that they're struggling with. Okay. And a lot of times people don't realize that blood work can tell the truth about a lot of things. Mm-hmm. Like someone can tell you, oh, I've been eating very healthy, blah, blah, blah. I'm like, okay, well, why is your lipid panel so elevated? Why do you have diabetes and not know it? So I always tell a patient at the end of the day, I hear you, but blood work is going to be the ultimate tell of what I see. That way I can address everything that could be causing those symptoms.
Yeah, your chemistry pretty much, right?
Correct.
Tells you what's going on. I've been diving a little deeper into a blood type diet, and I've seen miraculous changes in myself. My family has as well. Everyone that I've introduced it to has seen some major, major changes. I feel a whole lot better in so many different ways. Is that maybe part of your protocol at all?
I mean, it depends on the patient. Because the thing about it, one thing that I like to see, first of all, before like that type of going into that as far as, blood typing, I like to do food sensitivity testing because a lot of times people are eating foods that they like, but don't even know that that's causing their inflammation, that's causing their fatigue, and they're eating things that they don't need. And also you're finding out that, hey, this person has celiac disease. So you've been eating gluten and that's why you're having these issues. So it dives deeper into that first, but I wouldn't say that would be my first thing to do is blood typing, but definitely food sensitivity is very huge to get a basic synopsis of that patient's diet. And you'd be surprised, a lot of people are, hurt when they see that the foods that they really like is what's causing inflammation.
Yeah. Mm-hmm. Myself, I think I'm a type B, and I've eaten chicken ever since I've been born. And it hurt me to figure out that was actually making me inflamed. Mm-hmm. That and tomatoes. Eat a lot of tomatoes and everything, and those two things were killing me. Were really, really hurting me. I would get to a certain plateau, and I couldn't ever break that ever again. So that's a small tidbit of what goes on. But you dive in deeper. Mm-hmm. When you're looking at blood panels, what are you looking at exactly?
When I'm looking at blood panels, I'm pretty much checking everything because one thing I have noticed is every time I get a patient that comes from a family practitioner or something like that, there's always more that hasn't been done. Yeah. Okay. So I've seen where patients, only part of their thyroid has been checked, but you have to check everything. You have to check their TPO, their antibodies, their T3, their T4, because all those things make up your thyroid that could be hindering problems. So that tells you whether you need to increase that uptake of T4, T3 conversion levels so that they can have symptom relief. Because I've had patients, my best friend, for instance, he's like, man, I'm so exhausted. I don't know what's going on. He's 33, around my age. Right. Well, I did his blood work. Turns out he has Hashimoto's, had no idea.
No idea.
No idea.
Wow. For 33 years.
Yeah. And so it was more so over like the last couple of months. But the thing about these autoimmune disorders that they can come out of nowhere.
Right.
It could be stress, it could be lack of sleep, it could be other hormonal changes, or even just being sick, because that put a lot of stress on your body. So a lot of people don't know about these autoimmune diseases until it shows itself later on in life caused by something else.
Is that typically autoimmune diseases? They have an on and off switch.
Correct.
For the most part. And eating certain foods, definitely one of those things. Being in a high stress level, that's going to trigger that as well.
Correct.
Maybe even working out.
Or overtraining too.
Overtraining, yeah. Yeah.
And people don't realize that that is actually important. So, yes, I do test hormones as well, especially both men and women. And what a lot of people don't understand is just as a man needs testosterone, so does a woman, because those levels also decrease as you get older, and people don't realize that. And another thing I like to talk about, especially to educate guys, is you need to know more about women. When they have these periods, it's not that they're mad at you. The periods can really take over to cause depression, anxiety, or them to just lash out to make them seem like they're bipolar. It's called knowing when they have a period. So your wife or your girlfriend is more than just a beautiful person. You have to be ready for all those things that come about. So getting to know that about a woman, I'm telling you, it will save you a heartache in the end. But I say that to say, your hormones start to decrease in a normal person at 25 years old.
Wow.
But when you take into account eating processed foods,
Yes.
Not sleeping well, being stressed out, those types of things can lower it even more. And even people who are obese, that lowers your levels as well. And also people who overtrain.
Yeah.
So when I made that analysis a couple months ago, showing the blood work of someone who overtrains and someone who's overweight, both of them have very low testosterone, because you can have it from both dynamics.
And most people think they're working out, they're going to increase their testosterone, especially the lower body. That's what I've been told for years.
Correct. Yep. That's a myth.
Working out the lower body is not going to increase your
It's saying
testosterone.
a lot of times it said you working out would increase your testosterone levels. I have yet to see that.
Interesting. That's really, really interesting information, guys. So you see a lot of, and you do a lot of hormone replacement therapy. Any examples or any stories that you'd like to share with us?
Well, I had a 25-year-old who was had a very low testosterone. His was under 150. I know some people might be thinking, oh, he must have done steroids before. Actually, he never did. He didn't even have the frame of someone who looks like they've done steroids before. And what I tell people, there's a lot of reasons that your levels could be lower. And it has nothing to do with, for some people, they could be living a good, healthy lifestyle.
Yeah.
It's one of those things. It could be hereditary as well to have low testosterone. I know it's hereditary in my family to have low testosterone, as well as gynecomastia as well. So those are the kind of questions you have to dive deep into. But also, if people have autoimmune diseases, that can also lower other hormonal levels as well that people don't pay attention to. That's why when I do blood work on someone, it's a full panel, so they paint a picture as to what is going on. Like, for instance, I found a patient who had prostate cancer because he had a high PSA. Wow. He had never gotten that done, and you have to check a PSA before you can start testosterone. And so he had no idea he had prostate cancer. So then I asked more questions about symptoms. He was symptomatic, so that was caught. Wow. Some doctors just don't check everything, and I check everything.
That's worth its weight in gold. I mean, you saved the man's life, I imagine, changed the course of what it could have been.
Correct.
What I wanted to learn more about, and I think our viewers would like to know a little bit more about, is peptides. What do peptides do? And I know that you do a lot with peptides. Mm-hmm.
So peptides is, they are a branched chain amino acids. They are part of the amino acids that we already have in our bodies.
Okay.
But what these peptides are designed to do is they're going to increase the amount that we have to treat a specific function. Like, you have peptides for anxiety. You have peptides to increase your REM sleep so that you sleep longer. You have peptides that can decrease joint pain, or someone who has like Crohn's disease or IBS, where you have things like BPC that can decrease those inflammations that people are having. So there's a lot of peptides that can pretty much take the place of being on these pharmaceutical drugs. Wow. That have more side effects than they do with actually treating what they're designed to treat. So there's pretty much a peptide for everything. I mean, I've even used peptides as well as, things like NAD+.
Right.
I give it to clients status post cancer treatments. I've given it to clients coming off of alcohol or drug abuse.
Addiction.
Correct. And people don't realize that there's a lot of different things you can do for it. I've even developed my own protocol for it based off of what I've seen, because I also have a history of working in the drug abuse community as well. So, and there's other things that you can use as well. We do a lot of ketamine treatments as well.
Okay.
I mean, you could take a ketamine pill every other day, and it can significantly treat depression and anxiety.
Interesting. So a ketamine pill, and how long does that last typically?
Our pharmacy makes the intranasal spray as well as the troche, which is a small pill that dissolves under your tongue.
Okay.
And that can last anywhere, from 6 to 8 hours,
Right.
maybe longer depending on the patient. But I just like the fact that I can treat pain. You can even treat ADHD. Instead of using Adderall, you can use NAD and other peptides to actually induce more focus in a person. So the reason why we have these pharmaceutical drugs, because it's easy.
Yeah.
It's easy to say, hey, here's this Adderall script, instead of saying, hey, let me do more into making you more of a natural person, so you don't have to rely on this Adderall that, turns out this person, because of Adderall, now they have a meth addiction. So people don't realize these types of things that can cause problems later, because nobody knows they have the addictive gene.
Yeah.
You don't know until you actually use something, and then boom, there it is.
Right.
So that's why I like to do this type of medicine. I originally wanted to do orthopedics, but when I did outpatient therapy with a doctor, it was just a pill mill for oxycodone, and I don't want to do that.
Yeah. I mean, you're just kind of fueling the fire that's already been lit here.
And I used to work in the ER, but a lot of times with the ER, the reason why they're there is because of noncompliance. And I want to be the person that prevents them from going there. And the reason why these people have these issues is because they're not educated. They're not educated on how to shop, how to cook, or how to use substitutes for lower calories. And that's what I do, is I provide all of those services for patients to tune in, because one thing that sets me apart from most providers is they don't educate. When I posted one video showing clients how to shop around Publix and substitutes for sauces, substitutes for all these high calorie things, I got so many messages from people saying, thank you. I had no idea. And it was like, I wish my doctor had told me this. Doctors are so fast about, I need to go see as many patients as possible. Yep. But why don't you just sit that one time you spend an hour with that patient versus them coming back every month because, you haven't taught them nothing. It's worth that 1 hour.
Yeah, I agree.
It's quality over quantity.
I agree.
And so that's the problem with our world today, and why America's health is so bad.
Yeah.
I mean, I go to Barcelona in Brazil. I mean, I had French fries that wasn't even greasy.
Yeah,
I thought for sure I gained weight over there because I was tearing it up. But their food is just totally different. And that's why our health is the way it is because we don't spend time. Like, for instance, you can go to brunch. I hate going out to eat.
Yeah, you don't know what you're going to get.
Man, I could go to brunch and I could get an egg white omelet. The point of an egg white omelet is you want a low-fat meal.
You want it super clean.
Oh, my goodness. Dude, it is dripping in oil. I'm like, dude, the point of getting an egg white omelet was to be healthy. You just took the health right out of it.
Well, I mean, all the seed oils they put into the stuff at restaurants, that's rancid in your system.
I was like, buddy, it is 2024. I know you got a nonstick pan and you can put some avocado oil on spray on it.
Nah.
Come on now.
Canola oil all day long, man. Trying to give you these inflammatory diseases.
So yeah, I'd rather the only thing I go out to eat for is sushi. Something I don't want to make because it takes too much time. I go out to eat for sushi. Everything else I make at home myself.
Smart man.
Yeah.
And we should all follow suit to that too. Eating at home, it ends up being cheaper. You end up being healthier, and you're going to live a little longer with a better quality of life. That's for sure. Look at this man right here. He's the epitome of health. All right.
That's the goal, because we have a lot of healthcare providers out there on this weight loss kick trying to, take advantage of people's ignorance. But I see a lot of healthcare providers who are not in shape.
Yeah.
And if it were up to me as far as renewing your license, I'm like, no, you're going to pass this fitness test. If you don't, then you're not going to get your license renewed.
Makes a lot of sense. I mean, you're not going to let somebody blind or almost blind be on the road, So one topic that I get a lot in the chiropractic practice is joint pain, of course, right? We do it the chiropractic way, but we also refer out for things that are a little bit more chronic, and we can't really fix that fast. But I would like for you to break down to our audience about what the different kinds of shots for joint pain are. I know there's got a list of yours. Cortisone shots, which most people get at the ER. You got stem cells, PRP, and you got hyaluronic acid. You could break down all those for us.
First of all, I don't recommend cortisone shots because it is toxic. So with it being toxic, that means that each injection you give yourself, it can potentially eat away more of that cartilage. So you're putting yourself closer and closer to needing a knee replacement, and that doctor is going to cash in on your ignorance once again.
Right.
Then you have platelet-rich plasma. Your platelet-rich plasma has to do, its potency depends on your health status. So if you're someone who's overweight, diabetic, and have all these health issues, your PRP is not going to be nearly as potent or as beneficial as someone who's healthy. So guys, eating healthy is very important, even if you're going to be doing something like PRP. So you are what you eat in a sense. So your ability to heal yourself depends on your diet and your nutrition level.
Can we break down what PRP is for
Yes.
those that don't know?
So platelet-rich plasma is where we draw your blood, we spin it, and when we spin it, you have that yellow portion. So when I'm explaining platelet-rich plasma to patients, I take it back a level where I'm like, hey, you remember when you were a kid and you fell and scraped your knee? And then when you scraped your knee, as it was healing, you see that it's yellow over the top. So as it's yellow over the top, then a couple of days later, you're able to peel off that yellow, and then there's new skin produced under. That is PRP. And people are like, oh, I'm like, yeah.
That's the platelets.
Yeah.
Cleaning it up. Okay.
Correct. And so with that being said, then you could talk about the other things that it can do. So you can use PRP as an antimicrobial, which means it fights infection. So you could use it as a nebulizer for a kid with asthma. Wow. You can use it as an eye drop for someone with pink eye. You can use it to put on wounds. Wow. We use it for, of course, on the aesthetic side when we're doing microneedling on the face, where you just create a trauma to someone's face. So PRP said, oh my God, I need to fix that. So as soon as you put it on their face, it activates and it starts to heal the face over time. Wow. So if it does all of that, then imagine what it can do for a joint or if you put it in someone's scalp. So what it does is it tells those cells, I need you to regenerate to make this.
Right.
So that's what those cells do, right? So if you put it in a knee where there is inflammation, it's going to say, hey, I need you to make more cartilage for this knee to take away this inflammation. So over time, that's what the PRP is going to do.
It's your own blood.
Correct.
Your own blood.
Isn't that crazy?
Defines.
You can use your own body to heal itself. And these doctors know that they can do that, but they would rather give you a cortisone shot.
Well, it's a pharmaceutical, and there's some lines behind that are connected to things that we don't know.
And then you dive deeper and you use hyaluronic acid.
Okay.
Hyaluronic acid is only temporary, just like cortisone is only temporary, but it's not toxic to your body.
Okay.
But at the same time, it's like changing the oil to a tire. Once that oil runs out, then you're back to square one. It doesn't do anything to regenerate like PRP or stem cells can do. But you can use hyaluronic acid for temporary relief, but you can also, what I've done is I've mixed hyaluronic acid with PRP. So you have the oil to the tire and you have the regenerative process as well.
And shockwave therapy, something you do use. Can you tell us a little bit more about what that does?
Yeah.
Typically after the shot, right?
Correct.
Okay.
So what I do is I would do the injection, then I would apply red light therapy.
Oh, awesome.
And then after that, then I do the shockwave therapy.
The red light therapy is allowing that cell to open up a little bit more. And
it helps with, and it has also healing properties as well for inflammation. Women, of course, love it for their face. But when it comes to using for joints, that shockwave is going to essentially create trauma. Okay. So PRP again is thinking, oh my God, the body's being hurt. I need to fix it now.
Right.
So that's what you're getting from it. So you have anti-inflammatory properties that's there. Then you have it fighting against whatever's going on. We use that for the same reason when we're treating erectile dysfunction, because it's going to break up those blood vessels that have been damaged due to lack of blood flow. It's going to open up and allow that PRP to go in there to create new blood vessels. Wow. So we use it for a lot of different things. You can even use it for, like, if someone has lipo and they have fat deposits left over, you can use shockwave to get rid of those fat deposits.
Blast it through, get it out of the system, lymphatic drainage. Let's switch gears to weight loss. Since, the quality of your blood defines how healthy you are. PRP is your blood. You use that to heal yourself. So people with maybe that are overweight, maybe that have autoimmune diseases, name it, right? If you are in that group of people and you are overweight, what's some tips you can give some people to get back to a normal weight? And it's not going to be an easy feat. It's not going to be a quick feat, but what can you say?
The simplest way for anyone, even if they don't work out, is to move. Get up and walk.
Yeah.
Even if you eat dinner or lunch or breakfast, go and walk for 5-10 minutes. Call someone and walk and talk to them. Mm-hmm. I mean, even if you go into a grocery store, park at the end and walk all the way in. It's just like little things you can do to add more steps.
Right.
But again, America is so accustomed to being lazy. But then also too, if somebody has an autoimmune disease, you want to eat an autoimmune diet. So what does that mean? You want to eat foods that don't cause inflammation, like tomatoes. Those things cause inflammation, and people don't realize that. So there's a lot of different things that can cause inflammation that you want to stay away from, like chocolate for some people, spices for some people. Yeah. So you have a lot of things that can cause inflammation, but those are some things that can keep those cortisol levels down and things like that. But secondly, if you're fighting a battle with having a low testosterone or low estrogen, well, that's also a problem because you can't outwork hormones that need help. Because once your body starts producing it, well, now you're going to see, oh, I'm gaining body fat for no reason and I'm doing the right way. Well, you're doing the right things. You just can't outwork hormones that need help. And that's why it's called replacement. And one thing I do want to say about testosterone replacement is it is the difference between people, is that steroids use? Sir, I said replacement. Therapy. It's called therapy for a reason. Therapeutic, right? Just like you go see a psychologist. It's a therapeutic for you to get better. Same thing for testosterone. You're producing nothing.
Right.
This is why you're moody. This is why your wife want to slap you. Vice versa. You get on testosterone at a therapeutic dose. It's not going to make you a bodybuilder. We're getting you to a therapeutic level so that you can lose that weight, so you can feel better, so your libido's back, so your energy's back. And that's all it takes. And it's the same thing for women. Women who aren't in menopause can still have those symptoms. Women who are in menopause, them having hot flashes like crazy, doing a hormone replacement on them would significantly reduce symptoms. Do not believe your gynecologist when he says you're supposed to go through these symptoms. No, you're not. If you are using hormone replacement therapy, I promise you the symptoms are way less. And I have so many women that will tell you it saved their marriage. Seriously.
It's worth it.
Yeah.
It's worth it.
I'm telling you, guys don't realize it. Like, menopause is no joke for women.
Most people don't know that they have these issues.
And you know why they don't know?
Why is that?
Because I know I have to go to work. I know I have to take my kids to school. I know I have to go pay the bills. I know I have to do these things, not knowing that you could be way more optimal than what you are. So we're accustomed to knowing what we're supposed to do, even though we're not doing it optimally.
Creatures of comfort and habit.
Correct. And I tell people all the time, there's so many ways to treat hormonal deficiencies like testosterone without even doing an injection. You have pills that can increase your natural levels. And so that's why I tell people all the time, there is a way to treat everything the natural way.
It's not just shots with testosterone or estrogen. There's other ways.
We have pellets that are like small pills that go into the tissue of the butt, and it gives you a steady release of testosterone for 3 to 4 months for women, 4 to 5 months for men.
Oh, wow. Slow release.
Yep. And then you have like the troche, which is like the small pill you put under your tongue. And then you have the injections. You have creams. I don't really recommend creams because they're only about 40 to 45% effective, and you can rub it off on someone. And
the absorption rate's way low.
Yeah. So I don't really recommend that. My top two is the pellets and the injectable for sure.
Okay.
Mm-hmm. They're made by soy and yams.
That's the pellet, really? Mm-hmm. And everyone says, this is a great segue, soy, right? I've been told that soy is highly, it has a lot of estrogen in it.
Anything in excess, but it's not in excess because with the pellets, they also have an estrogen blocker in them.
Okay.
Yeah.
Interesting. Mm-hmm. So would you suggest a person who has low testosterone kind of stay off the soy diet if they are vegans, vegetarians, if they're having soy?
I mean, that's hard to do as a vegan because there's soy in pretty much everything.
Literally everything.
That's why I don't, sorry vegans, but that's why I don't recommend it. Because, I've had clients that, come to me for like muscle building, for instance. And I'm like, dude, you know how much protein you got to eat?
Yeah.
And there's soy in everything.
Everything. I mean, even the animals that we eat the soy, and we get it through passage that way.
Yeah.
So even if you think you're eating no soy, you're getting some if you're not knowing exactly where your meat's coming from.
Correct.
it's scary out there. It's kind of crazy how they stack the cards against us in the health, in the nutrition world. And we have to kind of dig and find the gems out of everything. Why don't we have a clear, transparent, this is what's healthy for you? I mean, the government's been telling us that sometimes eggs are bad for you, raw milk is terrible for you. Mm-hmm. Well, we know this is the oldest foods in the world, and they're telling us it's bad for us. I couldn't understand why, but I think I do.
Yeah, a lot of people say eggs are bad for you, but that's your good cholesterol. You want to have good cholesterol. You know, you want to do that than eating all these oils that aren't good for you. I would take eggs any day. I eat eggs every single day.
I had 3 this morning.
Cholesterol is great.
Yeah. When I was a young kid, I went to the family doctor, and I must have been 7 or 8 years old. He said that I had high cholesterol, and it freaked everyone out in the house because no one knew any better. No one was educated on this, and they made me feel bad for it. Like, I don't know what cholesterol is. I don't know why it's high. I'm just a kid. And then we started taking measurements, my parents did, to get my cholesterol lower. Forward 20 years or so, I become a chiropractor, and I learned that, good and bad cholesterol, they create your hormones, going back to the testosterone, going back to estrogen. So it's super essential, not just those two hormones, but everything. It regulates the way you feel, think, everything you just mentioned earlier in this podcast. So
correct.
I couldn't imagine why we're getting such bad information from those high ups.
Oh yeah, and even with a lot of these family practitioners, they are so hung up on numbers.
Yeah, studies.
A client can go and say, my libido is crap. I have no energy. The range for testosterone for a man is 300 to 900. Do you know how big a number that is?
Huge.
So if a guy's at 320, there's like, oh, you're still within range. Sir, this person is 35 years old. You think I want to come to you? Just take a day off to come to you? Who comes with these complaints and not want to get treated?
Right.
It makes no sense. But my thing is, they're so afraid to put somebody on testosterone, but you quick to write a script for Xanax or Percocet.
Isn't that crazy?
Make that make sense. And now this person is addicted to drugs because of that, where you couldn't give somebody testosterone, or because somebody's depressed, because of their hormones, you want to give them an antidepressant, which makes symptoms worse, instead of fixing the core of the problem, which is low testosterone. Make it make sense. I do not understand these providers. And then the ones that try to treat patients for low testosterone, I get a patient that, I get a shot once a month. What is that supposed to do? The half-life of testosterone is literally 6 days. Dang. So, sir, you feel like Superman for 4 days and you're back to square one.
You do it again the next month?
Yeah.
And hit the high?
They'll say once every 2 weeks or once a month. That is doing nothing. So, providers, and that's because they can use the insurance to make money off these clients. And that's what it's all about instead of actually treating the client. So I'm like, if you don't specialize in this, then stop, because all you're doing is making things worse. You get your little check and this person's over here suffering. Send them to someone who knows what they're doing, because I see it all the time. It's so annoying, so frustrating,
it's
so annoying.
A lot for you to dig back and just reverse engineer.
Oh yeah, so many clients, I've treated their hormones and taken them off of anti-anxiety, antidepressant meds, because their doctor was quick to give them an antidepressant instead of fixing a testosterone that's low as crap.
It just takes a little bit of time and a little bit of effort to these things are worth searching and finding the right answer for, because it is your life. It is not just your life, but everyone around you. And we're here to cultivate true health and create a community of amazingly healthy people. And this is the cycle that we are all in. We take the advice from our practitioners that may or may not know everything, and we just follow them blindly with this. Mr. James, one of the best that can do it here in Atlanta, not just in Atlanta, though you travel all around the country.
Oh yeah, I go to a lot of the big cities.
Yeah.
One thing I want you to know is you need to be an advocate of your own health. Don't be a yes man. Just because a doctor puts you on something, or they say they do something, or somebody tell you to jump off a bridge, are you going to jump? No, you need to be an advocate for your own health, because I get patients all the time who taking these medications and have no idea why. So you need to be an advocate for your own health, because at the end of the day, they could be telling you something that you don't even need. So don't be a yes man. Always investigate what you're on and why. Do your research, because at the end of the day, you're in control of your life.
Amen to that.
And I can't guarantee everybody's going to take care of you like me. So you have to be an advocate.
There's only one of him. All right.
Only one. I do have a twin, but he works for UPS.
He doesn't do the same stuff, of course.
Yes.
Deliver something.
All of my Amazon packages.
Everything else.
Yes.
Well, that was one of the best podcasts. I think it's very dense in knowledge. You guys, please rewind this, watch it over and over again, and pay the Gentle Giant some love. We appreciate everything. Y'all have a great one.
See you soon.